students. So till the end you should watch this, you must watch this video. So we will start with the syllabus quick review. After that we will tell about the question paper pattern and the important questions which we are expecting for the tomorrow's exam.
Our
So
voice
this will
is
be very
audible.
useful video.
Our voice is audible or not, please do comment in the chat box. Okay.
Whatever the queries you have, you can comment in the message box. Okay. So let's start with the anatomy and physiology. So later we will discuss about the microbiology. Okay. So the first we will talk about this anatomy and physiology, unit number 1.
Okay. So as you all know, it is a supplementary subject. Even though you have experience to write the examination, once again I will give you. Why? Because you know, keep on writing the examination is not an issue, but you have to get pass in the examination. That is why you have to use certain strategies. Okay. So that is what we are giving right now. So anatomy is all about the structure of the particular organ which is there in the human body. That is what you are going to study. And physiology, when it comes to the physiology, we are going to how it works. Okay, so hi all, hi.
So in the physiology you are going to study about the function of different systems. Okay, so let's start with the unit number 1.
So unit number 1 and microbiology later we can see. Okay, so we'll start with the anatomy unit number 1. In the anatomy unit number 1 we are going to study about the anatomical terms. Okay, so whether you know that what is that, we are having this postnatal, sorry posterior, anterior, sorry that I brought
lateral.
OBG came, sorry for that. Lateral, distal, this anterior, posterior. Okay, so these are, if
all those terms you will be studying, like
if
for
I
example,
come and told
skeleton,
suddenly,
what we'll use.
Suddenly if I come and told about this anterior, you could have not having an idea about this. Okay, you are freshly came to the course, right? So that is the issue. So that is why the entire anatomical terms you are going to be studying in the first unit.
Terminologies will be studied in
based on this terminology. 1 marks, 1 question
they will ask.
Definitely they will ask. Okay, so remember that. Then systems and cavities and the human body. Okay, so
all the systems of our human body, like for example digestive system, respiratory system, reproductive system. So all those the systems particularly, just you will study the review of all systems here, and each unit will be divided into all
based
those
on systems. Okay, so the evolution of the human body, cellular level of organization is there, no? Cellular level, tissue level, okay, then organ level, okay, organ, systemic. Okay, so this is how it has been developed, human body, right? No, so based on that only we are going to study the entire anatomy. Very easy subject if you study correct. Okay, so studying, everybody will study, my dear students. You have to use the strategies to study and remember, recall, represent in the examination. Okay, so first unit only terminologies. Second unit we will see now introduction to the detailed structure of the body. Okay, the structure of the body, how it has been formed. Okay, so in the cellular level, okay, so entire cell organization,
including that membrane, glands, the types and structure and functions of those tissues, and you might have studied this epithelial tissue, connective tissues. So all those will be comes under this particular unit. You have to study more concentration on that connective tissues and types of
classification of connective tissue is there. Okay, so that you have to study. Okay,
very
a small
important
classification is there that you put it on in a one flow chart. That will going to be helpful you to get the good marks. Okay, so entire things will be in the second unit over. Okay, so now we can go with the blood. Okay, so the blood is that we have a blood and blood products, and we have the components. Okay, so and how the blood will formation, where the blood will formation inside the bone itself, it is going to be bone marrow, it is going to be form. Okay, so that formation and the functions of the blood. Okay, so what are the functions of the blood? And
then blood clotting, blood grouping and the cross matching of the blood, all those you should study. Okay, blood clotting, the important thing you have to study. Then clotting factors also you have to study in this. Okay,
and next thing is that
blood products and their uses. Like for example, we'll be having the plasma or the serum, what we call. So what are those components and what is the use of each blood components?
We are using those things. Okay, for example, this PAP and all they used to do for this hair transplant and all. Nowadays they are using the serum only. Okay, blood serum they used to use, and they will be going to inject, okay, so then they, through that they are going to be have a treatment for the hair transplant and all, okay. So that is how they are doing. So same like that in various disease condition also we are using certain blood products we were using, okay. So that is what in the blood, okay, their components, plasma, serum, whatever the things which will be there, serum, electrolytes present in the blood, okay, that and all, the level of them, okay, if it increase what will happen, if it decrease what will happen, everything will be there here. Next is circulatory system. In the circulatory system, unit number 4, we are going to study about your beautiful heart. Okay.
This is very, very important, okay. This is the most expected and the easiest question for your exam. So heart, structure of heart, functions of heart, conduction of heart, okay. So all those anatomy and the physiology together you will study in this, okay. Then blood vessels, the structure and the type of the blood vessels what we have. Then circulation of blood, this is very, very important, okay. Just a quick review of heart we will give. So here you already know that is a heart is a hollow and the muscular shaped organ which is located in the between the lungs, that is what we called as mediastinum, okay. So in that the location of heart is very important, you should know. Then the main function of the heart is to pump the blood okay, to all over the body, okay. The deoxygenated blood, it will be sending to the lungs for the purification. So after the purification of deoxygenated blood, the oxygenated blood will be traveling, or it's pumping the oxygenated blood to all over the body parts, okay. Then structure of the heart, when it comes to the structure of the heart, the location is between the two lungs, slightly to the left side of our chest, okay. That you should know, slightly to the left side of the chest. Then so size is you already know that it's approximately around the closed fist, okay, size fist. Next, the weight is approximately 250 to 350 grams in the adult, that you already know. Then the walls, we have a 3 layers of the walls of heart, that you already know, that endocardium, myocardium and the pericardium, okay.
Endo means inside, peri means outside,
myo means the middle lining, okay. Next, the chambers of heart, we have a 4 chambers, that is right atrium, right ventricle, left atrium and the left ventricle we have. Next is the valves of heart, you already know that. So we have 4, that is pulmonary valve, tricuspid valve and the bicuspid, bicuspid, pulmonary and the aortic valve, okay. This is very, very important, you should study. So the bicuspid we also called as mitral valve, that is also you should know that. Then major blood vessels which we can see in this heart, in the what are those in the sense, the aorta, pulmonary veins, pulmonary artery, then the inferior vena cava and the superior vena cava. So all those major blood vessels we can see. Then the main important thing is this is how the structure what I explained. Next is the functions of heart is very important. The function of heart is deoxygenated blood, it will be pumped to the lungs for the purification, okay. After the purification, definitely it will send to all over the body, and that blood will be consist of oxygen and the nutrients which is essential for our body growth and development, okay. That will be pumped. Then it removes the oxygen, carbon dioxide and the metabolic waste from our bed. Okay,
if you study this cardiac cycle, no, so there definitely they are going to ask in the physiology this cardiac cycle, okay. So there if you study this entire process means you will definitely get the marks, okay. So and blood pressure,
the circulation of blood, okay, how it starts from that deoxygenated blood from the superior and inferior vena cava to the right atrium and the tricuspid valve through that. So all those things, the conduction system also you should study, like that SA node and AV node, how that physiology of heart it works. So that is very important from this unit, okay. Next
so,
is
next is lymphatic
system. So in this lymphatic system you should know the lymph vessels and the lymph node structure and function. What is the importance of this lymph nodes and the lymphatic circulations, that also you should study. The main lymphatic tissue, it's like the thymus and the spleen.
Okay, so regarding the spleen structure and function of the spleen and the thymus, you have to focus more in the lymphatic system. So this is one of the very small system also. You could have revised it within 10 to 15 minutes. That is okay. Next important system is that respiratory system. There is a chance to ask the question from this particular system, okay.
So here you should know what are the structure of respiratory system,
So
then the function. Okay, what are the main functions of respiratory system? We have two divisions, that is upper respiratory tract and the lower respiratory tract. Okay, so in that the structures you should know, the trachea,
yeah,
voice box, then the lungs, bronchus,
so we have
bronchioles,
two lungs.
Right and the left. So all those you should study.
Yeah, we have that in the lungs, especially what will be happen, you know, in the respiratory system. Either they will be asked the question which is related to lungs. Okay, so don't be laughed, because
that inhalation and the exhalation happens.
That is the physiology. Okay, it's a general structure I have written. Okay, because you know you have to know how to write the diagram, because you don't have a time to write deep and very nice diagram. Nobody will need. Okay, so only you have to know that how the lungs will look and what are the parts. Okay, so you have to write about the parts and all. So alveoli will be there. Okay, so the functional unit of the lung is alveoli, right? So those and all you have to study properly. So either you have to, once you written a diagram means try to mention 4 to 5 parts. Okay, maximum 4 to 5 parts. You should not going to be come without mentioning the parts. Okay, if you are not mentioning any parts, your diagram is not going to get a single mark also.
It's waste of drawing.
Your putting effort is a waste. Okay, so that is why what I'm telling you, know, so you have to focus more on that. And one more thing, you have to focus in the
physiology of respiration. That is what we said, that inhalation and the exhalation process, inhale and exhale process, how it takes place in our lungs. That is very important.
Respiration process is very important in the physiology. If they are asking the question based on this only, they will ask. Next, digestive system. Okay, this is one of the very
easiest
important and easiest subject. Okay,
so here in the digestive system, you have to draw the structure of this stomach. Okay, esophagus, stomach, then the layer
body
of that.
see, layer of stomach will be there. This is the duodenum, cardiac sphincter. Okay, so this is the cardiac sphincter, this is the pylorus sphincter. Okay, so this is the pylorus. Okay, so
then here the important thing is the digestion, absorption and the metabolism of a food constants, how the digestion, absorption and the metabolism process occurs in our stomach. That is very important. You should study that 3 process: digestion, how it, where it starts, how it starts, then the absorption, after the digestion, absorption, how it takes place, then the last is metabolism process. You should study the chemical reactions, whatever it is that you should study this particularly. Next is the excretory system.
What happens, you know, when it comes to this one, this metabolism and the process of anabolism and catabolism, the entire process is there, no, that you have to study thoroughly. Digestion, they are asking from mouth to feces, that rectum, whatever the process which will be taken place inside, how it will be like in our mouth, the food will enter to our mouth and mix with the saliva. That process will be taken place, no. So from there, from the scratch, you have to explain until the rectum, what is the process and how it will come. This, what is that it will call, this extraction, oh sorry, yeah, excretion. Okay, so that one till excretion you have to explain entire this one. Okay,
next is excretory system.
Excretory system, that is what the urinary. Okay, so that is which is regarding the
kidney, structure of kidney. Once you draw on that structure of kidney, all together you can mention that ureter, urethra, bladder. So everything will be consist in that. Then adrenal glands.
Yeah, and you have to while writing this one, right? So this one, no, this kidney is there, no. wait, I have written my kidney. I will tell. 1 second. Wait. You write. See, madam is writing 2 kidneys also, both bilateral kidney she is writing, but you have to focus more on the things like, you know, 1 kidney you have to write after explaining this one. Why? Because they are asking 2 also. Okay, so they are asking, once they will ask that, write a structure of kidney, after that 1 kidney you take. Okay, so why I am writing, you know, so you can explain here nicely. So these are the nephrons. Okay, so try to explain more here. Okay, so this is the diagram and this is the explanatory part you have to use. Okay, so this is a cross-sectional part inside the kidney, what it is there. So then only the evaluator will going to understand, you know, better than. So this is how you have to represent in the exam. Okay, so this is all about the kidney, urethra, and the formation and composition of the urine.
This is very important question. Okay, formation and the compositions of urine. This you have to study. Okay, how the urine formation occurs. Then in the urine, what are the composition has there. Is there?
Yeah.
Oh, that you should study. Then the fluid and
The
electrolyte balance, that also important. You should study.
So the next one is the structure and function of the skin and regulation of the body temperature. Okay,
skin.
So,
it's also one of the excretory system
integumentary
part.
also it is included here itself in your syllabus, based on your syllabus. Okay, so that you have to study.
Why?
So,
Because that is also through the skin, the sweat will be excreted. No? So
yeah. That is there where it will come in the electrolyte and fluid imbalance. Okay, next one is endocrine system. So endocrine system, you have to know about the structure and functions of the endocrine system.
Pituitary glands, thyroid, then
parathyroid gland, and as well as adrenal
gland, pancreas, ovaries, and the testes.
Okay, so these are the glands you have to thoroughly study. Okay,
yes.
So
they will ask each gland's functions. That is very important. Structure of those glands and the functions.
See, for example, pancreas is responsible for the production of the insulin. Okay, so that is how you have to.
What function of this pancreas?
One liner also they can ask this one. Okay, next one is reproductive system.
So here in the reproductive system, we will be studying about the female reproductive system and as well as the male reproductive system. So when it comes to the female reproductive system, you should know the structure of female reproductive system and the male reproductive system. The main thing in the female reproductive system, you should know about the menstrual cycle, the physiology of menstrual cycle, that reproduction, what is menarche, what is menopause, all those things you should know.
And in the menstrual cycle, that 4 phases will become now. So those 4 phases you have to study, and while explaining the menstrual cycle, you have to explain all the 4 phases. Okay, so and when it comes to the diagrams, uterus. Okay, so uterus is very important as a part of your reproductive system. Okay, so when it comes to the female reproductive system. Okay, so hope you understood this one. So this is all about the
and it includes the breast. Breast
structure, functions. Mammary gland. Okay, mammary gland. Okay, so try to know about the breast also, and as well as you have to focus on more about the things which is like like structure of the mammary gland. They are asking very rarely. I didn't saw anywhere, but even it is GNM examination, we can't predict, no. So that also you study and go. Okay, so most of the time they used to ask about this functions only. Okay, so these are the structure of ovaries,
female reproductive system. Then when it comes to the structure of male reproductive system, the functions of male reproductive system you should study. Then the structure and the function, it's very important. Each part, what is the function of that male reproductive systems. Okay, then reproductive health, that is also 2 marks or 1 mark. Sometimes they will be asking that what is reproductive health. Okay, next is
this one and all about the reproductive system. Okay, we are expecting the short note type of questions from this particular unit, and as well as we are expecting the things which is we are expecting like long essay also sometimes. Then
next
that memory gland, don't forget. Nervous system. So in the nervous system, types of nerves and structure of and functions. That neuron, one neuron is there, no. So from childhood we are studying that neuron. Okay, so that neuron, that only. Same. So same this neuron function structure is there, no. So either we can write, we can write like this also, or we can write most of the time we used to write like this. Okay, so you can, so this is okay, very easy to draw. So this one will come same like either this. You can write or you can write like this. Okay, so this is the structure of the neuron.
That is very important. The function of neuron and the structure of neuron you should study. Then the brain and the cranial nerves. We have 12 cranial nerves that you should study.
So that functions of the cranial nerves. Okay, so certain mnemonics will come. Okay, so that, so if you want detail that one right now, so that detailed classes we have taken in our YouTube channel. If you want, means you go and check it off. And again we are going to take a little more detailed classes for especially for GNM students who are in the second year, first year. Now we are in the first year, no. For second year also you take that benefit of it, and get pass in the examination. Okay, so there is no supplementary, only pass in the first attempt. Okay, so now we are supplementary, we are help you to pass in the supplementary also. Okay, so that is the thing. Next one is
spinal cord and the motor and sensory pathways of that you should study. Next is sensory organs. So in the sensory organs, you all know that you are going to study about the skin, eye, ears, and the nose and tongue. The sensory organ, the physiology of vision, hearing, smell, touch,
taste, and equilibrium. Okay, so these are the things which we are studying the sensory organs. Okay, so all structure of the skin, structure of the this one, you know,
ear, nose. See, that is very easy to
draw. Skin is very easy, right? Like this. Okay, so little then bit of hair will be there here.
Hair you have to write. Then epidermis, all those layers you should.
Dermis. You should subcutaneous write. This is fascia, bone, muscle, everything will be in the last layer. Okay, so easily you can write it off. This and all, no need to put your extraordinary drawing.
Don't waste in this.
Yeah, some people are there, madam. They used to do this. Suppose this one, they will do side here shading.
So why you want to waste all those time and efforts in that drawing?
Have you seen any MBBS students paper? Okay, they will write it like anything, all the structures. Okay,
only the content is very important. What you are writing. Okay.
Yeah, that is very important.
Next is the skeleton. Next unit, the formation and growth of bones. How many bones we have, ossification of bone. Then the classification of bones and joints is very important.
Short bone, long bone, and this one patella, short bone, long bone, and flat bones. Okay, so and
all the phalanges, tarsal, metatarsal,
carpal. So all these things classification will come, no? And
tibia, fibula. Joints, we have types of joints. So in that you have to study, especially that synovial joint is very important.
Synovial joint and joint movement is there, no? So that is very important. That diagram also you should nicely draw. Okay. Synovial joint. This is how it will come. So you have to draw it properly, that synovial joint, and you have to explain about that movement also.
Next is axial and appendicular skeleton. That is what the division classification will be started. From that you should start that writing answer. Next is
and this sternum is there, no? It is one of the sternum. So they are going to ask in the one liner or else give the example for the flat bone. So that is a sternum. Okay, so sternum you can give.
The muscular system. Last is the types and structure of muscles and the function of muscles is very important. What is muscles? What are the structure of muscle? Types of muscle. Then what is the main functions of the muscle?
Gluteus maximus, gluteus medius, deltoid muscles are very important as part of the nursing. Okay, regarding this one muscle, no, 630 muscle we have in our body, and that is very difficult to remember right now. So major important questions you have to study and go. Okay, so this is the very important regarding the bioscience. In that also anatomy and physiology. Whatever we told, no, in that focus the things. Comparatively structure you study, comparatively in the same one line functions you recall. Now there is no study, recall. Okay, so if you recall it, definitely you will pass. Now we are going to our beautiful subject, microbiology. So in the microbiology we have around 6 units. Okay, so 6 units are microbiology is one of the very important topic. As a part of your GNM syllabus, we have only 6 units. In that mainly we are focusing on the bacteria, okay, viruses, how it will be there, and the growth and development of the bacteria, and how the causing because those are the causing agents, right? So overall review we are seeing. Okay, so the next one is that
introduction in that microbiology. Okay, history of microbiology, the father of microbiology, definition, all those you have to study, the scope of microbiology. Okay, that is important. Next, in the second unit, that classification of microorganisms. Okay, the classification characteristics. Each microorganism you should study the structure. Okay, morphology of that, characteristics of particular microorganisms.
1 second, madam. Hi, MSN important. We already finished. Now only we finished the live session in the YouTube and Instagram as well. We already posted also. You go and watch it. You go and watch it, you will get
MSN1.
there.
When we
MSN1.
started with MSN1, everybody was
Was
asking about
asked
anatomy and
anatomy
micro.
physiology.
Now they are asking
About MSN.
MSN. Okay,
Yeah.
fine.
So it is okay. Go and watch it off. And now we are saw this microbiology. 1 second. Start.
So in the second unit, the microorganisms, there you have to study about the structure, size, morphology of characteristics of all those microorganisms. It's very, very important. Okay. Then you should know the diagram of cell, bacterial cell. That is also very important and expected question. Then methods for study of microbes. So that you already know. No? Culture. Culture, okay, culture media, what methods we will use to identify the microorganisms. That culture method you should know. Next is infection and its transmission. So we already know that the source of infection and the transmission, the mode of transmission of infection, that especially the nosocomial infection.
ನಾಳೆത്തെ ಎಕ್ಸಾಮ್ ಬರೋ ಇಂಪಾರ್ಟೆಂಟ್ ಕ್ವೆಶನ್ಸ್.
Yes, we will tell. Okay.
Yeah, just wait. We will finish it off this microbiology, and at last we are going to tell about the important questions only. Okay.
So what are the types of infection? Then what is nosocomial infection?
So nosocomial
hospital acquired infection is also called as nosocomial infection. When the patient or the attender is in the hospital, during that time, if they got any infection or the inflammations to the body,
due to the hospital visit, okay, the hospital is the main reason to get the infection is called as nosocomial. Or they can ask that HAI, expand HAI, hospital acquired infection. Okay, so that you have to know, and this principles, lot of things will comes under the nosocomial infection, that you focus more. And cycle
and transmission of the infection. Okay, the portal entry, portal exit of those mode of transmission. Like you know that through the feces, through the splits, through the air. Yeah. So all those you should know. Next is important unit, that is immunity. So in that immunity, the types of immunity, definition of immunity, then what is innate and acquired. Okay. What is innate immunity and the acquired immunity you should know. Yeah. And very important thing is you should know about the immunization schedule.
Yes, that is very important. Types of immunity, active, passive, that is there, no, that you have to study thoroughly. The difference between the active and passive. They may ask what is the difference between the innate and the acquired. Innate means by birth itself. Okay. So the acquired means
through the vaccines we are getting from the outsource.
So yeah, the next one is immunization schedule. Pakka question is that you will definitely get it off.
Next is hypersensitivity reaction, then autoimmune disorders you should study. Then what is vaccine carrier means what all those vaccines you should know.
Cold chain. Regarding that and all you have to study. Okay.
Next is control and destruction of microbes. Okay. So in this, the
sterilization,
that methods of destruction,
microbial control. Okay. So this is very important. This one we are using in the hospital, especially to curb the transfer of the infection. Okay. So that is why sterilization, disinfection, chemotherapy, and antibiotics. Then pasteurization.
These are the very important methods which we are using to control the microorganisms growth in the hospitals. Okay. So what are the sterilization, what are the process we will use in that methods of sterilization is there, especially this autoclave that you should study. Then what is medical asepsis and the surgical asepsis. Okay, that also you have to study. Then biosafety and the waste management, you already studied this. Biomedical waste management is very important. What is biomedical waste management? Color codes and the categories of biomedical waste management.
Okay, so
the last unit is practical microbiology.
So here microscope, parts
the handling of microscope and the parts and uses of microscope you should know. The diagram of microscope it's very important. You should study
that one. And
then staining. What is staining? Culture media. What is culture media? Methods of culture media. Types of staining. Then identification of the common microorganisms through using this microscope. Okay, all those will be important in this particular unit. Okay, so far we discussed about the
bioscience. Okay, so regarding the anatomy, physiology, and as well as the microbiology. Now you don't waste the time, take a question.
Important questions.
Madam
So
will
we
tell
will
now.
start with the important questions of your bioscience. So which include anatomy, physiology and the microbiology. Okay. So take down, describe the structure and functions of the heart with a neat diagram.
Yeah.
Okay. Next, explain the respiratory system and the mechanism of respiration. This we already said.
Both it will come in the physiology. Okay. So the question from physiology.
Describe the urinary system and the process of urine formation. This is also very important. Then explain the digestive system and the process of digestion, absorption and the metabolism. Okay. Describe the nervous system and the structure of neuron. That is very important. You should know. Then structure and functions of the skin. This is also very important. Structure of the eye. Then structure and functions of the liver, bones of the skeletal system, then endocrine glands and their functions. So all those glands you should list down, and the functions of each gland we have to write.
Okay.
Then blood groups and the RH factor. What is RH factor? We have that RH negative and the positive. Then the structure and functions of the kidney. And then female reproductive system and the male reproductive system. Then when it comes to physiology, we have composition and functions of blood. So cardiac cycle.
Cardiac
physiology
cycle will
of
be there in
respiration.
the physiology, and next one is that physiology of respiration, mechanism of urine formation, that we have already told. Okay, next one is endocrine glands and hormones. Okay, so which gland is responsible for secretion of the which hormone? Okay, so in the pituitary gland we have lot of luteinizing hormone or FSH. Okay, so a lot of hormone will be there, no? So you have to know that and you have to list
What
it
is the
down.
function of those
Hormones.
hormones?
Okay, so short note they may ask this question. Okay,
Then cardiac output, hemoglobin, blood pressure and its regulations, menstrual cycle, body temperature regulation, how that body temperature will be controlled. Okay, then reflex action, physiology of digestion, that is also very important. Then functions of blood. Okay, when it comes to microbiology, you know that sterilization and disinfection is important. Chain of infection and the prevention is very important. Immunity and the immunization. Then hospital acquired infection or the nosocomial infection, it's both are same. Hospital acquired infection, or else we can call it as nosocomial infection. Then medical and surgical asepsis. Okay, next is bacteria and the classification of bacteria. Then the structure of bacterial cell, virus, fungi, hand washing techniques, biomedical waste management, then standard safety precautions, vaccines, culture media, staining.
Then
Next,
define anatomy, physiology, microbiology in one
neuron,
marker. Okay,
one
so
mark, what we can
neuron,
expect means
nephron,
neuron,
alveoli, pulse, then blood pressure,
universal donor, and who, yes, that is also important. Who is a universal donor?
Fill in the blanks. O positive is the universal donor. Okay.
Universal recipient.
Recipient. And next one is sterilization, disinfection, immunity, active,
infection,
passive, pathogen. Okay, this is causing microorganism. We will call it as a pathogen. Patho means disease, gen means microorganism. Okay.
Next, so normal body temperature, normal pulse rate, functions of liver, functions of kidney, types of joints, and the cranial nerves. 12 cranial nerves, you should study this. This is also very important. Yeah, so far we discussed about the bioscience for your tomorrow's exam. We are end of our session. So those who are asking about the MSN 1, please go through
check it
with
out
our YouTube videos.
Yeah, and check it out in our Instagram story. There we have given the link also. You just go and click the link, you will get the video. Okay, so complete video will be there. So far we have given the important questions also. Whatever we have said, no, that important questions, just make a slow of the video and just take it down from one page. Okay, so write it down in your book and let's start to recall it. Okay, most of the question will come from that only. Okay, it's so that is we have given, and so much of thanks for your attention and attending our classes. Okay, so all the best for your examination, and we have know the question paper pattern because you have already attended, no? So that is why we are not telling that question paper pattern. You know that meaning, fill in the blanks, true or false, short note, answer the following. One 7-mark question will come. Okay, true or false will be there, and a short note, short essay type of question will be there. Okay, so carefully study the question paper before going to answer. Write your answer in a good handwriting and follow all the schematic representation and write a diagram, and wherever the necessary completely label the diagram without fail. Okay, so these are the general instructions. And you have to enter to the exam hall before 30 minutes and collect your hall ticket and all, and go with the ID card, proper uniform. Don't be stress yourself in the examination hall. So these are all the things, if you follow, definitely you will get pass in the examination. Supplementary is not going to be make you feel bad. You will definitely pass this time. Thank you so much. We will see
all
you in
the
the
best
next.
for your tomorrow's exam.
Yeah.
So see you in the next videos. Thank you.
Thank you.